Welcome to Mercy Medical Center's live seminar. Today we'll be discussing depression and seasonal affective disorder. Joining us is Alyssa Drury, a licensed mental health counselor from Mercy Family Counseling. After a discussion, she will take questions from our audience. To submit your questions anytime during the discussion, go to the box in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be confidential. Well, welcome, Alyssa. Let's go ahead and get started.
Hello, everyone, and thank you for joining me today. My name is Alyssa Drury, and I'm a mental health counselor and a substance abuse counselor with Mercy Family Counseling and EAP services. I also do some work with Sedlacek, doing alcohol and drug abuse treatment with clients. I've been in the field for approximately 15 years, and I've worked at a variety of places prior to coming to Mercy in September 2010. If you have any questions today or comments during my presentation, don't hesitate to speak up. I will be talking about depression and seasonal affective disorder today. Following the presentation, I will have some time to answer your questions. Okay, what is depression? Depression is not occasionally feeling sad. The symptoms, which we will cover, they usually interfere with our daily life and our daily functioning. This means that a person's career, relationships, self-care, social life, schoolwork, and ability to perform basic daily tasks can be affected. Depression can cause immense emotional pain for a person. It is common and can be very serious if the symptoms lead to suicidal thoughts and/or suicidal attempts. A person suffering from depression usually needs some type of treatment in order for him or her to begin to feel better. I'll cover the different types of treatment later. Right now we'll talk about the different types of depression. The first one that is very common is called major depressive disorder. This is a disorder that is very, very common. Symptoms associated with this include the following. For someone to have a major depressive disorder, they need to have a major depressive episode, and that needs to occur over a 2-week period. It includes several symptoms being present, such as depressed mood nearly every day, loss of interest or pleasure, significant weight loss or weight gain, sleeping too much or sleeping very little, agitation, fatigue or loss of energy, feelings of worthlessness or inappropriate guilt, and recurrent thoughts of death, suicide, or plans to commit suicide, with or without a plan. These episodes can occur multiple times throughout a person's life, or it can occur only once. I'd like to say a few things about suicidal thoughts related to depression here. At times when a person is experiencing multiple symptoms of depression, suicidal thoughts can just creep into the mind, whether it's intentional or not on the person's part. Most clients will tell me if this is happening, but some are scared to talk about it for fear that a counselor would have them put in the hospital so that they can be safe. It's important to talk about this with someone if it's happening to you. Usually, but not all the time, a medical or mental health professional will want you to be hospitalized when there is a clear plan of what one is going to do to commit suicide. A lot of times people will willingly go to the hospital because when these types of thoughts creep into their mind, it can be very scary. Another type of depression is seasonal affective disorder. These symptoms start in the fall and they continue into the winter months generally. The key to seasonal affective disorder is that it occurs at the same time every year. The symptoms are typically less common in the spring and the summer. It's different than depression because it occurs only at certain times of the year. With depression, the symptoms can occur at any time of the year. Common symptoms associated with seasonal affective disorder include the following: hopelessness, loss of energy, social withdrawal, oversleeping, loss of interest in activities you once enjoyed, appetite changes, difficulty concentrating, suicidal thoughts, irritability, and anxiety. There are also some other types of depression, which I'll briefly just touch on those here. One of these is called dysthymic disorder. This is similar to depression, except that the symptoms are less severe or intense, and they occur over a longer period of time, which is supposed to be a 2-year period of time. Another type of depression is psychotic depression, which is depression that is accompanied by psychosis. Psychosis includes having hallucinations where you see, hear, feel, taste, or smell things that others don't. And delusions is a part of psychosis also. A delusion is a fixed belief that something is happening when in reality it is not. And the last type that I'll touch on real quick here is postpartum depression. This occurs when a new mother develops a major depressive disorder within 1 month of giving birth to a child. About 10 to 15% of women experience this after giving birth. So let's talk about some of the risk factors. One of the risk factors for developing depression or seasonal affective disorder is that if you're female, if you're a female, you're at higher risk. Research shows that statistically more women than men suffer from depression. Another risk factor is if you have a family history of depression, then you're more likely to develop similar symptoms. If you're between the ages of 18 and 30, you're also more at risk to develop seasonal affective disorder or depression. And then specifically with seasonal affective disorder, those people that live farther from the equator have a higher risk of developing this. This is because there are decreased hours of sunlight during the day in places that are farther from the equator. Some research has shown this to be a factor, especially with seasonal affective disorder. In the winter months, there's less sunlight, which can be linked to the symptoms of depression. Let's talk about some of the causes of depression and seasonal affective disorder. There really is no single cause. Depression can be a disorder of the brain where there is simply a chemical imbalance. Sometimes this occurs due to genetics. There may be a family history of depression, and if so, then it is more likely that something can trigger the genetics for the depression to occur. If it is purely a chemical imbalance in the brain, we generally know that this is the case when someone is having symptoms, they take medication, and the depression gets better. Most of the time, though, this is not the case. In my experience, it can be a combination of both medication and counseling that can improve symptoms. There is also what I call situational depression. This occurs when certain things in a person's life are so stressful that the symptoms of depression appear. The good news is that with the situational depression, counseling or therapy can help to improve the symptoms, but it takes willingness on the person's part to work on it and want it to get better. In my experience, in my opinion, depression seems to have a lot to do with how we talk to ourselves inside of our head, what we tell ourselves, and if we believe these things or not. Some interesting information on how this affects women and men differently. Depression is more common in women than it is in men. There are biological, life cycle, hormonal, and psychosocial factors unique to women that may be linked to higher rates of depression. Women are also more likely to acknowledge feelings of sadness, worthlessness, and/or excessive guilt. Men are more likely to acknowledge fatigue, irritability, loss of interest, and sleep disturbances. Men are also more likely to turn to alcohol or drugs to cope with the symptoms. And they are also more likely to become frustrated, discouraged, irritable, or angry in response to how they're feeling. Some throw themselves into their work to engage in reckless or risky behavior, and men are also more likely than women to complete suicide. Childhood depression often persists, recurs, and continues into adulthood, especially when it's been untreated. Depressive symptoms can also be a predictor of more severe illnesses that could develop in adulthood. A child may pretend to be sick, refuse to go to school, cling to a parent, or worry that a parent may die if they're having some symptoms of depression. An adolescent may sulk, get into trouble at school, be negative, be irritable, and feel misunderstood. By age 15, girls are twice as likely than boys to have experienced a major depressive episode. For older adults or the elderly, they may show different, less obvious symptoms than other adults. This is because they may be less inclined to acknowledge feelings of sadness or grief because they are older and may think that it's just part of the aging process. They're more likely to have medical conditions and to take other medications. Some of the medications may have side effects that contribute to their depressive symptoms, such as poor appetite or excessive sleepiness. Older white males age 85 and older have the highest suicide rate. So how is depression detected and treated? Most people, in my experience, report symptoms first to their primary care physician. At Mercy Family Counseling and EAP services, we do get quite a few referrals from doctors that have seen a patient and they're complaining about symptoms of depression. The physician then may put them on medication if they're open to that and recommend that they come see one of us counselors at Mercy Family Counseling so that we can work on that end of things with them. Some people come and see a counselor first, and then if they're interested in medications, we'll refer them to someone who can prescribe those medications to them. A lot of people don't want to have to take medications, so I also work with them in counseling to try and improve the symptoms without the medications. A person can also visit a psychologist or a psychiatrist for some of the same services as far as prescribing medications. So how can you help yourself if you're feeling depressed? If you think you might be suffering from this or seasonal affective disorder, visit a doctor or a counselor. Physical activity is also a way to cope with depression because it can be a way to relieve stress, but also to feel better about yourself and more confident. Get outside if you can, even if the sun isn't out. If you're suffering with many symptoms of this, I would encourage you to not make any major decisions or changes in your life right now. These can be things like getting a divorce, having a child, moving across the country, because those are big decisions, and when we're not feeling our best, sometimes we may make some that we might regret later on. Find someone that you can confide in and talk about what you're struggling with. That can be a good friend, a close family member, or a counselor. It's important to keep some structure to your days, even if you don't feel like it. If you can, go to work. If you aren't working, keep some structure to the day, even if you don't leave the house. Some examples of this are just making sure you get up around the same time every morning, take a shower every day, schedule some time in for reading, schedule time for cleaning or laundry, yard work, and try to go to bed around the same time every night. Another thing you can do is work on your thinking and how you talk to yourself. Are you constantly beating yourself up in your head during the day? Are you putting yourself down a lot? Are you worrying about things all the time and it's not accomplishing anything for you? I think worry and anxiety take up a lot of energy, and we can really feel drained and worn out from that, and then that can present as a symptom of depression too. And you may want to ask yourself, are you spending your energy worrying about things that you have no control over? Also, we need to take time for ourselves to reflect on things or do something for ourselves, such as taking a nice bath, going shopping, if you just need to sit in silence, or writing or journaling. For some people, doing some writing or journaling right before they go to bed helps them to relax enough so that they can fall asleep. I see a lot of clients who have a lot of trouble falling asleep because they're laying in bed and they're worrying about things, and their thoughts are constantly going. And for some people, if you can just, write that down on a piece of paper, whether you have a journal or a notebook, then your worries are going to be right there. You're not going to forget anything. They'll be right there in the morning when you wake up. So how is depression detected? I would encourage you to visit a doctor. Usually a doctor will rule out any medical conditions before depression or seasonal affective disorder can be diagnosed. One example of a medical condition that can kind of mimic some of the symptoms of depression is having a thyroid imbalance. This can make a person gain weight or lose weight quickly and significantly. It can also make a person very tired, which can be a symptom of depression also. Once the medical conditions are ruled out by a doctor, then it's going to be more likely that you would be diagnosed with depression. And then usually a physician will encourage you to see a counselor, a psychologist, or a psychiatrist. Okay, treatment options. One of the treatment options for depression and seasonal affective disorder is psychotherapy, which is counseling therapy. During counseling or psychotherapy, what happens a lot of the time is you'll learn about your condition, you'll learn about your moods, your feelings, your thoughts, and your behaviors. One's mood and behaviors can also add to the symptoms of depression and seasonal affective disorder. In therapy, you'll learn healthy ways how to cope with symptoms and stress in your life. Therapy can also help you to identify and change negative thoughts and behaviors that may be making you feel worse. There are many different types of psychotherapy or counseling. Each has its own approach. The type that's right for you really just depends on your own individual situation. And I know for me as a counselor, I really try to be flexible and adapt my approach to things on an individualized basis because not everything works for everybody the same. Another treatment option is alternative treatments. One of these is herbal remedies and supplements. One that's really common is called St. John's wort. You can find it at any Hy-Vee or Drug Town in the vitamins section. It's an herb that's been used for centuries to treat a variety of illnesses, including depression. It's not approved by the Food and Drug Administration to treat depression in the United States. Right now it's just classified as a dietary supplement. However, it is a popular depression treatment in Europe, and it may be helpful if you have mild or moderate depression. A lot of people, or some people, want to try and take these type of herbal remedies first before they try a prescription medication. There's another option. It's called SAMe. It's spelled S-A-M-E, which is a synthetic form of a chemical that occurs naturally in our bodies. This is also not approved by the FDA to treat depression in the United States. But in Europe, it is used as a prescription drug to treat depression currently. Another type is omega-3 fatty acids. Eating a diet rich in omega-3s or taking omega-3 supplements may help ease depression and also appears to have a number of other health benefits, such as just feeling healthier, having more energy. I just want you to keep in mind, though, too, that the nutritional and dietary products aren't monitored by the Food and Drug Administration the same way medications are. You can't always be certain of what you're getting and if it's safe. Also be aware that some herbal and dietary supplements can interfere with prescription medications or cause dangerous interactions. To be safe, please talk to your doctor, healthcare providers, pharmacists before taking any of these herbal or dietary supplements. Another form of alternative treatment includes mind-body connections. The connection between our mind and our body has been studied for centuries. Complementary and alternative medicine practitioners believe the mind and body must be in harmony for you to stay healthy. Some of these techniques that are used to improve depressive symptoms include acupuncture, yoga, meditation, guided imagery, and massage therapy. As with the dietary supplements, take care in using these techniques. Although they may pose less of a risk, relying solely on these therapies may not be enough to treat depression fully. If you try mind-body techniques or other alternative therapies first to treat your depression, and your symptoms worsen or don't improve, please talk to your doctor. Another treatment option for seasonal affective disorder specifically is what we call light therapy. This is also called phototherapy. Light therapy is a way to get the sunlight that we're missing in the winter months. Because the earth is farther away from the sun during the winter, we don't have as many daylight hours. There are specialized light therapy boxes you can purchase and keep in your home. Most of these are portable boxes that you can carry and plug in to any outlet in your home. And what these therapy boxes do is they mimic outdoor light. Research has shown that outdoor light causes a change in brain chemicals linked to mood. It's very easy to use. It has very few side effects, if any. I've worked with several clients that use this on a daily basis, regardless of if it's in the winter months or not. Some people turn the light on while they're getting ready for the day in the morning and sit in front of the light. Some people find that they need to keep it on just when they're home all the time, and that it generally helps their mood improve during the winter months. And the last treatment option I'll talk about is medications. Let me just first say that I'm not a physician, I'm not a psychiatrist or anyone who is allowed to prescribe medications. What I talk about here is just from my experience with clients and interactions with doctors regarding medications that are prescribed to clients. Some of the more common medications that I've found in my practice for depression that I've come into contact with include fluoxetine, which is also called Prozac, citalopram, which is also Celexa, sertraline, which is Zoloft, Lexapro, Effexor, and Cymbalta, and there's a newer antidepressant out called Vibrid that I've had many of my newer clients, they've been put on by their physicians. I've been told that a person is highly encouraged to take regular doses as prescribed for at least 3 to 4 weeks before likely noticing any effects. It's important to continue to take the medication even if a person is feeling better. Do not make changes, stop taking the medication, or lower or increase the dosage unless approved by your doctor. Some medications need to be gradually stopped because there can be a risk of withdrawal from certain drugs, so you need to be careful. Some people decide that they need to continue to take their medication for the rest of their life, and others try to get off of it eventually with the assistance of their doctor and the continued support of counseling. Finding the right medication can be a very frustrating process because not all medications affect all of us the same. It's very individualized as far as medications are concerned. It usually takes 3 to 4 weeks for a person to feel the full effect of a medication. If you don't notice any changes or any improvements, then you're going to have to try another medication and then wait another 3 to 4 weeks to see if that one works. So it can be a very frustrating process for a lot of people. If you have family members that struggle with depression or other symptoms of seasonal affective disorder and they're on medications that are working good for them, most likely your doctor is going to try that medication for you first, just because it's had success with family members. For most people struggling with depression or seasonal affective disorder, it takes a few months or even years to figure out when your symptoms get worse, when they get better, you know, kind of what the cycle is for you. It may be at certain times of the year, it may depend on a person's stress level, or it may be a cycle that occurs frequently, you know, every month, every few months, you get an increase in symptoms. And unfortunately, time is just part of that. We have to monitor it and just try to figure out what our pattern is, if there is any pattern. So we're able to prevent some of these symptoms from becoming worse when we know what our own personal pattern is. When we don't know, it makes it much more difficult, and it takes some time to figure that out. One important thing to be aware of is when you notice symptoms beginning to surface. If you're able to catch these early on, it's more likely the symptoms will not be as severe as if you had not noticed. This can help prevent the symptoms from getting worse over time too. If you know your symptoms will appear or get worse at a certain time of the year, especially with seasonal affective disorder, a lot of people who suffer from this, they know that in September or October that their symptoms are usually going to start. And they're going to get worse in the winter. And so if we know that about ourselves, then we can do some things to take some steps to try and keep the symptoms so they don't get real severe. So if you're on medications, or you know that you have seasonal affective disorder and winter's coming, it's highly encouraged that you start taking those in the fall, or if you also do counseling to help monitor your symptoms and cope with things, to start that in the fall, follow through with it through the winter months, even into early spring, and then when your symptoms usually go away in the spring, then you can stop the treatment then. Some people like to just do it year-round, just for the general support of counseling. And some people choose to take the medication year-round too. So everybody's a little different. One thing I want to talk about briefly is addiction too, and its relationship to depression, anxiety, and seasonal affective disorder. I think it's very relevant, and I think it's very common, at least from my substance abuse treatment experiences. The terms, I don't know if you've heard them or not, dual disorders or co-occurring disorders, those terms are becoming more and more popular, and Iowa is currently working to merge both the mental health and the addiction treatment fields. So what's the relationship between addiction and depression? Alcohol or drugs are often used to self-medicate the symptoms of anxiety or depression. Alcohol and drug use can increase the underlying risk for just having a mental disorder. It can also make the symptoms of depression or anxiety worse for people in the long run. We can use alcohol and drugs to escape how we're feeling, but if we're truly suffering from depression or seasonal affective disorder, it's only a temporary escape. When the alcohol and drugs is out of our system, those same feelings of depression and anxiety are still there. And also, alcohol and drugs can possibly cancel out any type of medication for depression, because you're feeling depressed, so you take an antidepressant, which tries to lift your mood up and make you feel better. But then when you drink alcohol, that's also a depressant, so it cancels out the medication. So it's recommended that you do not drink or use drugs while you're on this type of medication. Otherwise, sometimes the medication just doesn't work because of that counteraction. I have just a few statistics too about this topic. Roughly 50% of individuals with mental disorders are affected by substance abuse. 37% of alcohol abusers and 53% of drug abusers also have at least one serious mental illness. Of all people diagnosed as mentally ill, and that includes anxiety, depression, those diagnoses that are not as intense or as hard, 29% abuse either alcohol or drugs. Some other things for you to think about: consider your family history. If people in your family have struggled with a mental health disorder or addiction, you do have a higher risk of developing these problems yourself. Consider your sensitivity to alcohol or drugs. Are you highly sensitive to the effects of alcohol or drugs? Have you noticed a relationship between your substance use and your mental health? For example, do you get depressed when you drink, or do you drink when you get depressed? Is there a relationship there? Look at your symptoms when you're sober, when you're not drinking or using drugs. Do you still have those symptoms of depression or anxiety? If you've stopped drinking or using drugs and you've achieved some sobriety and you're still having those symptoms, then you may be dealing with a mental health problem that you may need some help with. Review your treatment history. Have you ever been treated before for either your addiction or your mental health problem? Did previous substance abuse treatment fail because of complications from your mental health issues, or vice versa? So those are just some things to think about in relation to addiction and depression and seasonal affective disorder. I thought I would put up some resources and references for you if anybody out there is interested in reading any of these books. The Feeling Good Handbook by David Burns, that's a very popular book. It's also very good. It's got activities in it you can do for yourself. Another book, it's called Thoughts and Feelings. Mind Over Mood is another one. I have these books in my office, and a lot of them have just some educational stuff about your moods, your thoughts, your feelings, but also some worksheets or kind of self-reflection activities you can do. And then Change Your Brain, Change Your Life. That's been pretty publicized, I think, through the media. It's a pretty popular book about, again, about working on your thinking and figuring out how your brain works. A couple other ones I wanted to put on here. This first web link up here is a link to an online article that I found very helpful, a lot of information in it if you're looking for information on the co-occurring disorders when substance abuse is complicated by mental health problems. Also, the National Institute of Mental Health website is a very good website for basic information on all the different types of disorders, including seasonal affective disorder and depression. And there's a lot of information on that website too. The Mayo Clinic website has a lot of good information too, in my opinion. Basic information, it explains things in regular language. It's not as scientific language that people can understand. And then a couple other ones, if you're interested, the Substance Abuse and Mental Health Services Administration website. That's another one for good information. And then the National Institute on Drug Abuse website is listed here too for you. Okay, and that's all for me right now, and we'll start doing questions and answers.
Thank you, Alyssa. Great information, very thorough, but we do want to open this up to questions from our audience now. You can submit your questions from the box in the upper right-hand corner of your screen. If you don't see the box and the spot to submit your questions, click on the little orange square in the upper right-hand corner, and you'll see the box with questions. You then can just type your questions in, and I will ask them of Alyssa. Okay, our first question, Alyssa. I know a number of men who are dealing with depression. Have you seen an increase in cases of depression in men recently? And if so, why is this?
I think we have seen an increase of men with depression, but I think that part of that might be that I think society is getting more acceptable of men expressing those type of feelings and being able to say I'm struggling, I need some help, whereas before they may have just really just kept a lot of it to themselves. And so I think society is accepting more, that men can be more emotional and they can have these feelings, and that they don't need to hide it, and there's help out there for it.
So actually that's good news, I think, when you look at those numbers. Okay, another question, can you clarify the difference between a psychiatrist, a counselor, and a psychologist? And then, do I need a physician's referral to be seen by any or all of these health professionals?
The difference between a counselor, a psychologist, and a psychiatrist, a counselor or therapist is usually someone with a master's degree in either social work or mental health counseling, rehabilitation counseling, and most people who are in practice need to have, as far as the mental health counseling, 2 additional years of working before they can get their state license, so that they have a license to practice in mental health counseling or social work. A psychologist is someone who usually has a master's degree or a PhD in psychology or counseling psychology. And psychologists typically obtain more training and research and testing than counselors and social workers. Psychologists are not able to prescribe medications in most states. For a psychiatrist, if you want to be a psychiatrist, you need to go through medical school, just like a regular physician does. But a psychiatrist has additional training on psychology and more counseling and social work type of things too, and the medications that are associated with all of the different psychological disorders. And psychiatrists are able to prescribe medications. Most of the time, it's my understanding that you don't need to have a doctor referral to go see any of these. A lot of the times, if someone's seeing a doctor or a psychiatrist and a counselor, all of us that are providing the services can kind of work together to try to help the person figure out and help them feel better from each different approach. So, no, you don't need to have a referral.
Right. Thank you. Next question. Can seasonal affective depression turn into clinical depression?
In my opinion, I think it can. I think that, once those symptoms are triggered in the brain or someone's really struggling with those things, I think that it can turn into it. I think it just depends on the person's situation and if there's other stressors in their life that could continue those symptoms on more than just for the winter or, the winter blue season.
Here's a very good question, I think. Can you give some ideas for changing thoughts and self-talk to help alleviate the symptoms of depression? Now, I know we could have a webinar probably specific to just changing thoughts, but just a couple common sense or helpful suggestions?
Sure. And I do this a lot with my clients that are working on their symptoms, is about working on the thoughts and the self-talk. And some ideas for changing those. Number one, you have to be aware of when you're doing it. You have to be aware of when you're telling yourself negative things or if you're being very critical of yourself. So you have to be aware of it when you're doing it. And then you have to be able to stop yourself and then replace those thoughts with something else. I give people a handout that I have quite a bit, and it talks about these different thinking distortions that are very common that people use. And then it has a list of some phrases that you can replace some of those thoughts with. One that helps a lot of people that I work with is worrying about this accomplishing anything for me right now? Or do I really want to spend my energy putting myself down all the time, or do I want to spend my energy on something more productive? So those are a couple of tips of phrases that you can kind of use. And if you want me to email you that handout, you're welcome to contact me at my email, which is on the screen there. I have no problem giving that to you if you think you might find it helpful.
Very good. Another question here, Alyssa. Since the flood, have you noticed a population of depression expressed by drinking and drug use?
I have actually recently come into contact with several people that went through the flood, and they're really just, it's really just sinking in to them right now. Um, I've also met with several people who have turned to drinking and drug use during the flood, since the flood, just because of the stress. People that have owned businesses and lost businesses, and you know, a change of jobs, and people, you know, have worked at some of those jobs and were planning on retiring at some of those, and the business got wiped out. And so I have seen some increase, at least in the work that I do, of people, you know, feeling depressed and using alcohol and drugs to kind of cope with those symptoms.
We have a couple questions that have come in that are similar, and talking about asking how long to wait to get help after the winter months. You know, and after the winter months, you know, how long before the symptoms subside? You know, how long should you wait before I get help? I guess really how to separate, is that seasonal affective disorder, or is it a clinical depression that needs more attention? Can you address that question?
I think that there really isn't a set answer for that. I think it's very individualized, and like I mentioned, I think earlier, with seasonal affective disorder, it takes some time to, number one, figure out if that's what you're suffering from. Number two, to figure out what is the pattern. Is there a pattern of when your symptoms start or when they typically end, or decrease? So I think it's important, you know, that you, as soon as you're noticing something, you know, if you're wondering if this is what you have, or maybe you're developing it, as soon as you know, recognize some of these symptoms that we talked about here today, for you to, you know, just go talk to your doctor or go talk to a counselor, and then the two of you can kind of work that out as far as what your pattern is and when you need to do certain things and what you need to do at certain times.
In other words, get the help. Don't try to figure it out yourself. Get to your doctor, get to your counselor. Alyssa, you mentioned St. John's wort. Are there any specific negative interactions with other medications if you use St. John's wort?
Like I mentioned earlier, I'm not a doctor or a pharmacist, so I really can't answer that. I think if you're wondering about that, you need to talk to your doctor or to your pharmacist about that, and they should be able to tell you if there's any concerns you need to take care of.
Another question here. Where can I purchase light therapy bulbs and or a box, and then what is the cost?
For the light boxes, you can generally go online and order those. There's different sizes of those. They can range from $100 to $400 depending on the size and the quality that you want. For the light bulbs that mimic outdoor light, they usually need to say full spectrum daylight or sunlight light bulbs. They're getting them now in a lot of the stores. You can get them online, or they're more expensive than, you know, our typical light bulbs that we've been using. I think around $10 for 2 or 4 bulbs. You can go to Menards. I think Walmart has some when I was looking. And just make sure they say full spectrum or daylight or sunlight light bulbs.
I believe we have covered all the questions submitted to us, at least up to this point. But if you have additional concerns or questions, Alyssa can be reached at 319-398-6694 or 319-398-6459, or by her email address, which is listed on your screen, adrury@mercycare.org. Now, a tape of this program will be available at www.mercycare.org/live in a couple days. So you can also check back to this website for information about future webinars and then listen to past webinars. Our next webinar is titled The Impact of Social Media on Children with Nancy Whitaker and Catherine Roberts from Mercy Family Counseling. I've seen a little bit of a preview of this, and it is going to contain a lot of good, helpful information for everyone. This will be Thursday, February 16th at noon, and they will also take your questions live after their discussion. Okay, I'm just checking. I don't believe we have had any new questions come in. So I just want to thank everyone for joining us today.